the government agency, development partners, and the Joint National Association of Persons with Disability. So please can we welcome Malam Lewali to represent the disability community on this item. Thank you very much.
All right, thank you so much, distinguished ladies and gentlemen. In between the topic with the theme, there is a these are, or rather, the topic at hand too. The role of government and development partners in promoting disability issues in Kaduna State. Distinguished ladies and gentlemen, supposed to be chaired by the person that just spoke, Joseph Wires. So at this point in time, I will allow the government representative to hold on when we get to hear from Science Center, then we'll move to WHO, then we'll come to Statistics, Persons with Disability, then end with the representative of the government. Can we give them a big round of applause as I hand over the microphone? Just in a minute, say something so that we'll come to ask one or two questions, then we conclude.
Thank you very much, the moderator. Good afternoon, everyone, once again. So, from the theme of this occasion, we are all stakeholders here, one way or the other, and we have to find out a way how we can work together to improve things. So we don't want things to remain in normal status quo. As for WHO, we are not a funding body, but we normally support the states, specifically the Ministry of Health, in conducting activities. And since part of our strategy is inclusiveness, announcements on TV, we know that people that can hear and can see can access that. And those that can read, can hand out bills. So these are things we need to ensure that we're not missing anybody. Access to healthcare. The other speaker was talking about the healthcare services. Accessibility is a bit difficult. So I think this is something we are looking into now for at least our general hospitals, secondary hospitals, tertiary. There are some, not optimal, but there's some amount of accessibility. But this should not be forgotten. We should need to keep on making sure we do some sort of assessment in our health facilities to make sure that we have a focal person in these health facilities that has that knowledge of special needs, has knowledge of Braille or how to do sign language, so that anybody coming in to health facility to seek help is able to express themselves and navigate and get the needed help the person needs. So these are just ways in which we can support the state in ensuring that these key things, these key gaps are covered. And then another aspect that WHO is passionate about is what we call, we want to fight against gender-based violence. And from statistics, we realize that people with disabilities, especially women with disabilities, are more prone to gender-based violence. And we are willing to support, for example, commemorating such maybe Gender-Based Violence Day, International Day of Human Rights. We can work through the Ministry of Health, and then through maybe a focal person from the board can liaise with the Ministry of Health, liaise with us as well. And so that's where we can come in. So we don't come in directly, but we can come in through the Ministry of Health, through joint collaboration. And that is why we are here, to show that we are here for you, to support you, and tell you the ways in which you can support. Thank you so much.
Okay, can we appreciate that once more?
So, from Save the Children now, there are various ways where we all need to come in and play our part in ensuring our society is inclusive. And They are different areas. Now we look into governance and policies. Yes, there's a role for the government to play in the place of implementation of existing laws, ensuring that they are domesticated in a number of those communities where we have structures that are not inclusive, where we have facilities, health facilities particularly, school facilities, normal social facilities, for example, a structure like this hall, where they don't have consideration for persons with disability. Now we have laws on ground that actually guide this, but however these laws are not being pursued, they are not being implemented. Now this is one rule where government can come in place, and we are doing a lot of work to raise sensitization and awareness around the importance of this. The Play project actually has three windows. One of these windows targets governance and policies. Finally, we are ensuring our education system is qualitative and inclusive, ensuring our health systems are also inclusive and accessible, attitude of service providers, access to inclusive amenities in the hospitals, so for example, the restrooms, and another section where we can work together is collaboration and coordination. Someone mentioned how can we have a technical working group so as to ensure that our various resources and strengths are being augmented, they are complementing each other instead of duplicating efforts and wasting resources. So this is also one very good way with committee hub, where the organizations on ground can actually give it monthly or quarterly updates on what we are doing, what we plan to do, so we can know, okay, where are the locations, the communities, the LGs, where services or our interventions are not reaching. So this is one of the very good. Another one is identifying grassroots structures. If there are none, we need to start looking at setting up some grassroots structures. We have persons with disability in communities all around Kaduna State. But whenever we go to communities to do an assessment, to do awareness of installation, to do a meeting, to do a town hall meeting, we often find very few persons with disability present. And often that is because they are often at times excluded, they are marginalized against. They don't have access to this information, or they are not aware that this type of interventions are going on in their own community. So we need to now be intentional about identifying them and bringing them into the discussion, into the decision making, ensuring they have meaningful participation. For Save Children, apologies. For Save Children International, we are particular about inclusive and quality education for all children. Currently in Kaduna, we have two projects that are directly targeting out of school children. Combinedly, they are looking at 400,000 out of school learners that need to be identified and try to bring them into a literacy and numeracy boost system, where within a few period of time, they can catch up with their colleagues that are already in school. And then we have a way of streamlining them into the formal education system after they finish with this boost program. Now, out of that 400,000, we have a minimum focus for 10% minimum persons with disability, children with disability. Minimum. We're looking to go above that, but minimum standard on this project we're looking at. So out of 400, we're expecting 40,000 children with disability to be in this program. And we're not just giving them this literacy boost alone, we're providing them with referral for medical assessment, so that the disability level and the assistive device that they require are medically assessed by specialists, and we provide assistive devices for them to, be able to move into a formal school system. Besides that, also in our sexual reproductive health and health programming, we look at how our health facility service providers are trained on how to provide disability-friendly services. A person doesn't come to our facility and then you naturally stigmatize against them. This will cause them to not come back to access the services. So we are looking at not just training the service providers now, but also ensuring that the services in these hospitals are inclusive for all. They have railings, they have ramps, and then they have handles where they can grab onto and use these amenities with ease. So for time constraints, I want to stop here. Thank you very much. And we also, as an organization, are looking forward to doing more with the board. Yes, this is one of the collaborations we'll be having with the board, and we look to push it for more and more. Ogania mentioned how we can plan without budget. It's a very good one. We look towards sustainability. If we keep attaching money to everything, when funds are not available to fund, it dies. It dies. So we need to have a call to action for each and every one of us present here. No matter how little effort you think your effort is, it goes a long way. It goes a long way. We need to claim ownership of these interventions that we are planning towards doing, so it can last longer than we can imagine. Last longer than us ourselves, even when we are no longer here. Thank you very much.
All right, thank you so much, distinguished ladies and gentlemen. Let me hand over the mic to Bureau for Statistics, then come to Ogaran 1, then we complete with the ministry.
Please, ma'am, we should be brief so that we can complete.
Oh, yes, very much. Well done, everyone. So you can now see, like I mentioned in the morning, the importance of data cannot be overemphasized actually. So now I want to mention some points where we can use statistics to break barriers. Now, first and foremost, you see, we have the needs for evidence-based decision making. So without data, government doesn't know. If at least we have a baseline data, government can use that to identify gaps, to know where we are, where we want to start from. Then from there, government can be able to plan very well for the disabled. Then secondly, there is need. We cannot conclude without talking about awareness and advocacy. Because without awareness and advocacy, we need to really amplify and make this awareness. Let's advocate to the government to see the reasons, to make proper provisions for people with disability in terms of healthcare, in terms of education, and then so much more areas. Then secondly, I would also like to emphasize on the issue of collaborative effort. We need to collaborate. In as much as we need to get this done, then there is need for this collaborative effort. You can hear in the morning when JONAPWD was presenting, he made mention of the amount that was stated in the budget, and we are going to collaborate with the Disability Agency to carry out this work. So the earlier the better. There is the need for immediate action to be made, because the importance of statistics cannot just be overemphasized. So the first thing now is for the head of this agency to write to us with immediate effect, and let's start from somewhere. So from our own part, we have been trying to do our best, like making our data collection the inclusive type. We include, and there was a time we even wrote to the agency asking them of their data needs, which they have actually responded, and it was incorporated into our annual school census. And because the amount of people with disability in schools were just very insignificant, so we couldn't analyze, and that was why we couldn't get feedback. So there is a need for this collaboration. I have mentioned the word collaboration more than accountable time. So thank you very much.
Please bear with us. Before officer will speak, let me give officer say something in a minute or within a minute.
Okay, thank you very much for giving me another opportunity to speak. The primary duties of the police or primary objective is to protect life and property. Not only that, it's to prevent crimes from happening. So this capacity, this workshop, it is very handy. It will make sure that persons with disability can be given more priority in the society and can be engaged. They can be inclusively engaged. There is this popular saying that ideal man is a double workshop. So by neglecting any person in the community, that person can develop a habit of criminal mind. And by doing so,
more and more problems in the society will be arising. So, in our own part, we are doing everything humanly possible to do our own part as the security lead organization to prevent crimes from happening. And we are so much happy that this particular workshop, the first summit, has so much potential in the society. So thank you very much, and we so much look upon more and more summits like this to be occurrence in our society. This is very, very much important, and we really appreciate the organizers. Thank you very much.
Thank you so much, sir. Thank you so much for giving me another opportunity. Well, the theme of the summit is to break barrier. I can assure you from the side of OPDs that the barrier have already been broken. Yes, I can attest to that. For a group of organizations of persons with disability to bring these stakeholders on board, I think the barrier has been broken. The only thing we are after is to just put into action. I like the commitment of WHO. It's one of the organizations that Organization of Persons with Disability have not having that such partner. Just like she said, they normally align themselves with MDA in terms of even disability inclusion. You see, most of the ideas around disability inclusion comes within disability community, not the disability affairs board. Even what we are currently doing today is as a result of the engagement, the cordial relationship that the OPDs have with disability affairs board and in partnership with other stakeholders. That is what we are currently doing today. My key request, I think I have virtually made up my presentation, and which is I did it in summary, but my key request, I'm very optimistic that we have gotten one or two things as takeaway. If all of us will make a commitment that as individual, not just as organization, I will go and do one single thing. I think in 1 week time, there will be so many stories about disability inclusion in Kaduna State. We are more than 200 today. If only one, just get a half bag of cement, maybe in your doorstep, a very accessible place for somebody like me to use is something. Maybe go to your nearby neighbor that this is what persons with disability needs. I think the barrier have already been broken with this initiative. Another thing, like I earlier said, and I keep on emphasizing, that we cannot do it alone. We have to get more partnership in the area of disability inclusion, in the area of sustainability. Just like my friend said to me from Save the Children, if we rely on donor, what if the project comes to an end? What do we do next? If we do not get the habit of sustainability, I think we'll still go back to where we are. We have made a little shift, but we have not yet get to where we want to get to. But I'm sure we have made the shift. If you compare 10 years, 15 years back, there is no how organizations of persons with disability or persons with disability will bring these stakeholders on board, because that relationship is not there. I think persons with disability doesn't even have the space to approach FDAs, individual or stakeholder to come and sit in one table and discuss issues regarding to disability. But with the present happening today, I am happy that everybody you see today will be talking about disability. So with this development, we have a lot of ambassadors. We have a lot of people speaking on our behalf. I think this is a very good one. I want to appeal to my colleagues to appreciate all those that have been putting in their best to make sure they put smile in the faces of our faces. Issue of disability is issue of all. If you do not do it today for yourself, you do it today for another person. So let's get the habit of promoting disability inclusion in wherever you find yourself. And another request I want to make,
I want to request to the Disability Affairs Board that you should try as much as you could to engage the religious and traditional institutions, because this is where we have the really listeners, the really populations are there. If these people speak, I know what we use during polio eradication. We engage these two institutions and it gives us a very good result. So if we really want to get results, we still need to engage these two institutions, that is religious and traditional, to make sure that they are champions of disability inclusion. So thank you for giving me the opportunity, and thank you for the partnership, and thank you for everything. We wish you God bless all of us.
All right, thank you so much, everyone. Let me hand over the microphone to Cabinet Secretary, Ministry of Human Services. Perhaps you wrap it up for us. We'll come to you, then we conclude.
Thank you very much for yet another opportunity to say one or two things concerning the summit. I want to first and foremost appreciate our resource persons for doing justice to the subjects they took us through. Thank you very much for the wonderful exposition. And I must say that one or two things that I think are very, very important at this point in time are: one, there's a general consensus that there is a need